What's going on, guys, and welcome back to another video. So there's a lot of stuff happening right now. This week is going to be a very big week. They are going to continue negotiating that potentially $3.5 trillion infrastructure bill. But right now, the big discussions are on what is left for the American people. Right now, many lawmakers are still requesting additional stimulus benefits to the American people. They say there are still needs that must be met, and currently this can't happen when people who are not working are unable to find a job. That's true. Well, here's what we know. For about a month, the long-term unemployed have not been receiving any unemployment benefits because they maxed out their weeks. People that were self-employed are actually getting nothing unless they went back to work. The health insurance premiums that the government paid 100% of, well, this program ended 3 days ago on September 30th. So those people that lost their benefits because they lost their job and had to go and get, let's say, COBRA insurance, well, they are going to have to go back and get COBRA insurance or find a different job. However, the problem now is COBRA insurance is very expensive and many families cannot afford it. So these families will be going without insurance for some time. Well, this is just part of the reason why lawmakers are requesting additional stimulus, more benefits to the American people. Yeah, there's still people are still getting the larger tax credits for their children, but this only benefits those with children. We know the eviction crisis is still going to happen. We don't know how bad it's going to be. Well, lawmakers say that the states need to be sending out this money much faster. It needs to come out much quicker. But for now, 2/3 of Americans say that they're currently behind on rent. Let me rephrase that. Okay? 2/3 of Americans behind on rent currently say that within the next 2 months they will be evicted. Okay? One thing I just want to address is whether we see a stimulus check, chances are is not going to happen at this time. But whether we see additional stimulus benefits, increase to the earned income tax credits, if we see an extension of the government paying 100% of your health insurance premiums, right? If we see the extension of the unemployment benefits, maybe not the $300 per week, but the extension of the long-term unemployment benefits and pandemic unemployment assistance, we could potentially see those. We could see another eviction moratorium for possibly 60 days, maybe even a little bit longer. Those are different proposals that are on the table. However, still up for discussion as to how much we can get in this potentially $3.5 trillion bill. But what do we have in this human infrastructure bill? What is still there for the American people? Well, here's what I can tell you. Is there going to be more for the American people? We don't know. But the key here is we have to see these negotiations through. According to House Democrat Alexandria Ocasio-Cortez, AOC, she says there are options to move forward. She also says the compromises and options that we have before us is, do we shorten our funding programs? Do you reduce the level of funding? Do you cut programs out entirely? Well, she also went on to say, I think that one of the ideas that's out there is fully fund what we can fully fund. But maybe instead of doing it for 10 years, you fully fund it for just 5. I addressed this morning. I said this the other day as well, that's an option, that is something that multiple White House aides and Senate aides have said. That let's not take this for 10 years, but let's not cut the bill. Let's not cut the bill from 3.5 down to 1.5 and extend it for 10 years. Let's not do that. It's possible we could, but if we extend the bill for 10 years, it's the same time frame, but we cut it in half, it's going to actually leave many of these programs poorly funded, and they're not going to work right. So this is why more lawmakers are saying that this negotiation, it has to be on what piece of legislation are going to be in here. We are going to fully fund those, but instead of doing it for 5 or 10 years, we'll make sure it's a little bit shorter. Maybe we'll just cut the time in half or a little bit less than half, because at least that way everybody gets their different items in. Their agendas are met. Because everybody has always said, we're going to pass free community college. We're also going to pass expanding Medicare. We are going to do something like affordable housing. But they've never said, oh, we're going to do affordable housing for 10 years. We're going to expand Medicare for the next 10 years. We are going to provide free community college for the next 10 years. No. So that at least gives lawmakers a way out. They can at least satisfy their constituents. However, they just shortened the time frame. So they didn't lie. It's not a lie. That's at least the discussions going on right now. But here's the problem. Regarding the differences in this bill, multiple reporters are saying that Biden's affordable housing initiative is now pretty much off the table. It will be scrapped. Some are saying that this was on the verge of being cut weeks ago, but this bill that is going to be smaller now, there's no way affordable housing can have room to even fit into this bill. It's not going to happen. So affordable housing, well, that's gone. The sad part about this is that homelessness is going up, and finding an affordable place to live, honestly, it's almost impossible. It's very difficult at this time. Now, obviously affordable, it's different for every single person based off their income and kind of what they're accustomed to. But let me ask you this. Are you seeing more homeless people in your area as well? I ask this because experts anticipate that the amount of homeless people is going to only increase. They say this because as rents increase and the amounts of affordable housing isn't increased accordingly, that's going to be a problem. So we're going to see rents increase, and the middle class and the upper income earners, they're going to be able to afford those. But they can, in many cases, can also afford to buy their own home. So it's turned into a major issue right now. Here's another hurdle. This is a hurdle that we heard of today, okay? Now, Senator Joe Manchin, he brought this up earlier this week, but it wasn't actually addressed by, the people that oppose him, right? So today, we actually heard that Senator Joe Manchin, well, he says a bill will be dead on arrival if the Hyde Amendment is not included. Okay? Well, Progressive Chair Pramila Jayapal, she says that the Hyde Amendment can't be included in this infrastructure bill. So Joe Manchin says that if the Hyde Amendment is not included, the bill will be dead on arrival. Pramila Jayapal says this bill has to include or can't include the Hyde Amendment, or else she will not vote for it either. Well, who has more power? The U.S. Progressive Caucus Chairwoman Pramila Jayapal, who's in the House, or Senator Joe Manchin? Yeah, unfortunately, it's Senator Joe Manchin. Now, if you're not exactly sure what the Hyde Amendment is, it simply means there's a stipulation that prohibits taxpayer funds from or dollars from funding abortions. That's really all the Hyde Amendment is. That's pretty much the main piece behind it, and that's kind of what Pramila Jayapal is fighting for. Is no, let's not include this because, well, we could potentially use some of the taxpayer dollars in order to fund abortions if we needed to. Now she's not for that. That's not why she wants it, but there's other reasons in there as well. We don't exactly know what all those are, but my guess is we'll find out soon enough. Another issue. Bernie Sanders still wants to see Medicare fully funded, fully expanded, right? Expanded, not funded. It will be fully funded, according to Democrats. However, reports yesterday say that Democrats understand that the drop in age will not be included. They understand this, but Senator Bernie Sanders says, no, we need to still fight for this. There's about 20 to 25 million people that would benefit from that age decrease go from 65 down to 60 for Medicare. It's about 20 to 25 million people. So it's a big piece to this bill. But we know that right now the White House, according to reports today from the Washington Post, that they had plans to send major vision and dental benefits to seniors next year anyway. So that wasn't going to be an issue. So only passing vision and hearing at this point could possibly be in the bill, or Democrats could just agree, let's just pass hearing. Let's address hearing, and then we will pass something for vision and dental next year. That's possible. That's quite possible. Now, Republicans aren't going to like this, but this is something that is back in this bill as well. Democrats say that they are going to put the two bills back together. They're going to put these two bills back together. Now, this is the talks as of this morning and this afternoon. They say that we need to put these two bills back together like they should have been all along, but they could potentially get some pushback from moderates who like the fact that both bills are separate. That's the key. They want them separate because there's going to be certain things in the human infrastructure bill that they don't like, and so they can simply say, well, we're gonna hold off on passing that bill. We need to make sure we have this hard infrastructure bill passed first. Or, well, I don't like that particular part of the bill, so I'm going to vote no. Okay, and this is going to be especially beneficial for people in the House and the Senate. If a Democrat votes no, the bill dies. But here's what you need to understand. Right now, if a House Democrat decides to vote no on a bill, and we could see maybe up to 3 people vote no. These could be people in very hotly contested elections coming up in their campaigns. But what you need to keep in mind is, if somebody's very close to being overtaken by a Republican representative, okay, what you need to keep in mind is, if that person says, no, I'm not going to support that bill, their voters could actually look at that as, oh, okay, they didn't approve a tax increase to certain people. Or Republican voters can be like, they were actually on our side, so I'm not going to vote for this Republican. I'm going to vote for that Democrat because they're more of a moderate. We could potentially see that. So right now, that's the good news for Democrats, that we could see maybe 3 people do that in the House of Representatives. In the Senate, though, we don't have that option. But even House Minority Whip Steve Scalise said, and I quote, that Democrats are tying the infrastructure package hostage, and linking the two bills would devastate America's economy. Now, the reason why he is saying this, let me just break this down really quick. The reason why linking these two bills together could devastate America's economy is if the two bills don't pass. If they don't pass. Okay? The other way this could have been devastating to the economy is if a $1.2 trillion passed and a $3.5 trillion or higher bill passed. That could have been devastating as well. Okay? So right now, he's only saying that this could devastate the economy because the human infrastructure bill is going to be good. It's going to be great for the American people. But the hard infrastructure bill for infrastructure, roads, bridges, railways, things like that, that's going to really benefit the economy in 5 to 10 years. So that's why he's saying this could devastate the American economy. Let's get into some COVID news for today, though. Today, Dr. Anthony Fauci says that he agrees with Governor Gavin Newsom over the mandate for California school children. If you don't know what I'm talking about, I addressed this the other day, where there is now a proposal where California, and this would happen probably sometime July of 2022, where all school-age children in California would be required to go and get the COVID vaccine. Okay? They would be required to do that as long as the FDA has fully approved the vaccine for children 12 to 17. They haven't done that. They also they don't even have an approval, emergency youth authorization for children 5 to 11. So right now, they're just waiting on this. But once this full approval does come through, California could, change their laws and require this. Dr. Anthony Fauci says, and I quote, "People need to realize that having a vaccine requirement for schools is not a new, novel thing that is very peculiar or specific to COVID. We've been doing this for decades." He also says it's actually ongoing with other vaccines, so let's do it with a virus that's very, very serious. So that's his statement from today. He's also pushing back against the idea that we're going to get a COVID pill, a vaccine type pill. He says this is a good idea. This could help, but we're not going to see a vaccine come in a pill form. That's not what we're going to see. So, as I know more there, I promise I'll fill you in on that update as well. I just wanted to bring you this quick little update, provide you with some news out this afternoon. So again, if you have any questions whatsoever, please ask your questions down in the comment section below. Again, thank you guys for watching. Consider subscribing, and I'll see you guys on the next one.